I would like to invite our next speaker to Dr. Satrajeet Rai, sir, Head of the Department of Medicine at Sanctoria Hospital, Eastern Coalfields. Today he will be sharing the insight on the impact topic ozone exposure, diabetes and hypertension risks mediated by inflammation. May I request Dr. Satrajeet Rai to kindly take the stage, sir.
Good morning, respected delegates. Sorry for being late. I was the maiden speaker of the day, but I reached Varanasi yesterday at late night. So my topic is the ozone exposure and the development of hypertension and diabetes. In fact, I have never learned about the topic before the presentation in this conference. So it's a little bit challenge for me. So how to present, what are the relation, what are the pathophysiological link of this? But I have taken the challenge and I am thankful for the organizer for giving me the opportunity to present in this uncommon topic beside SGLT2, GLP and common topic we discussed in our diabetic and cardiology conferences. So, what is ozone? We know all of our knowledge is from the plus 2. The ozone is a molecule of 3 oxygen atoms. It exists in 2 parts of the atmosphere. The stratospheric ozone, it's a good ozone, located 10 to 15 km above the earth. It forms the ozone layer which protects us from the harmful UV radiations. Whereas there is like bad lipid, there is bad ozone, that is the ground level ozone. This ozone involved in the ozone exposure. It forms near the earth surface and harmful to the human. The ground level ozone forms when pollutants react in the sunlight, mainly in the nitrogen oxide from the vehicle and the power plant, and volatile organic compounds or VOCs from the industries, fuel, vapors and solvents. These react under the sunlight to produce the harmful ozone or bad ozone. This picture is published by the NASA, the ozone hole of our universe. Now what is the relation of this ozone with development of diabetes and hypertension? So first of all, we have to know what are the sources of the ozone. Vehicle exhaust, coal-based power plant, industrial emissions, urban traffic pollution, burning of the fossil fuel, chemical solvent. High levels are usually seen in the urban areas during the afternoons. How human beings are exposed to ozone? Exposure mainly occurs through the inhalations of the polluted air, especially in the outdoor worker, people exercising in the outdoor, and especially in the highly polluted cities, Delhi, Mumbai, Kolkata, etc. Now, what are the different health effects of the ozone? The ozone is basically a strong oxidant that damages our respiratory system. There are few short-term effects like throat irritations, cough, chest tightness, shortness of the breath, reduced lung function and worsening of the asthma. And the long-term effects that may lead to CLD, although there are not so many data, lung inflammation, cardiovascular disease, development of hypertension and development of type 2 diabetes that ultimately leads to increased mortality. What is the basic pathophysiology? That is systemic oxidative stress, endothelial dysfunction and definitely insulin resistance are the major culprit. The ozone concentration is usually measured by parts per million and microgram per cubic millimeter. And air quality indexes classify ozone level into safe and hazard zones. Nowadays, in social media, in paper, the air quality indexes is a very hot topic. Now, the mechanism of the damage due to ozone is due to the oxidative stress, inflammation, autonomic nervous system imbalance, endothelial dysregulation, and metabolic dysregulation. This endothelial dysfunction and metabolic dysregulation, these two things are more important in terms of development of hypertension and diabetes due to the ozone exposure. So the pathophysiology is basically the production of the reactive oxygen species. That leads to the systemic inflammation by production of IL-6, TNF-alpha and CRP, the activation of the immune response and increased circulating inflammatory mediators that ultimately leads to endothelial dysfunction by reduced nitric oxide bioavailability, increased vascular stiffness and impaired vasodilatation as all cases of diabetes and coronary artery disease. There are few studies postulate the autonomic nervous system imbalance due to the sympathetic overactivity, increased heart rate and vascular tone that ultimately lead to the metabolic dysregulations, and clinical outcome is the development of type 2 diabetes and hypertension. So in a nutshell, the main thing is the endothelial dysfunction. If we consider hypertension, if we consider diabetes, if we consider CAD, aging, everything, the endothelial dysfunction is the main thing. So is there any evidences? There are not so much studies, but American Heart Association, Lancet, they have done studies on this. As per the American Heart Association, air pollution and cardiovascular disease, a statement for healthcare professional from the expert panel on the population and prevention, they produced the journal, and the key message is that exposure to the air pollution contributes to the cardiovascular morbidity and mortality. And mechanistic pathways include, as I have described earlier, systemic inflammation, autonomic imbalance, endothelial dysfunction, and that leads to the promotion of the early atherosclerosis. As per the Lancet, there is an association of the long-term exposure to the ozone to the cardiovascular mortality and its metabolic mediators. The evidence from a nationwide population-based cohort study. The key findings are the long-term ozone exposure was significantly associated with higher cardiovascular mortality and metabolic factors like lipids, glucose metabolism, inflammation, and mediated large proportion of these associations. So if we see the graph, the ozone exposure and cardiometabolic risk, there is a direct proportional relationship. There is increased ozone exposure, increased direct cardiometabolic risk. And there are several studies like Lee et al., large prospective cohort studies. I am not going into the details of the studies, but all the studies shows that if there is a long-term ozone exposure, there may be a development of endothelial dysfunction, oxidative stress, damages to the arterial stiffness and stiffness of the arteries, and ultimately leads to hypertension and diabetes. So how to prevent the ozone exposure? It is very difficult for us, but especially those who are working in the outside. Us doctors, we are working under a chamber or hospital. So it may be possible for us, but not possible for those who are working in the outside, because the ozone radiation is highest time during 12 p.m. to 5 p.m. And heavy exercise outdoor avoid, and use the indoor air purifiers, HEPA filter air purifiers. Although these are theoretically right, because maximum people can't afford these things. So ozone exposure contributes to the oxidative stress and systemic inflammation. This mechanism promotes the insulin resistance and an endothelial dysfunction, and this links to the ozone exposure with the increased incidence of development of hypertension and diabetes. Thank you everybody for your patience hearing. Thank you organizing committee for inviting me, and I invite all of you in the 6th ACDA Con, which is the largest diabetic conference outside Kolkata in West Bengal, not in the West Bengal, in associated Jharkhand and Bihar also. Thank you everybody for your patience hearing.